Benjamin Decatur, 19, obsessive-compulsive disorder.
A 34 on the Y-box scale, normal being 6 to 10. He's no longer able to even feed himself. His parents have kept him alive by force-feeding him protein shakes.
Which brings us to the punchline, Dr. Ridgway. Why are we here?
I'm seeking approval to perform an unconventional radiosurgical treatment. An anterior capsulotomy using gamma knife.
Psychosurgery.
Except instead of cutting Mr. Decatur open, I'll be using radiation to sever the connective pathways in his brain that contribute to the obsessive thoughts.
Bullshit.
Something to say, Dr. Villanueva?
She's talking about a high-tech lobotomy.
It's not a lobotomy.
She's gonna go into the kid's brain, do a little snip-snip to change his
It's
personality.
not snip-snip, it's
that
radiation.
adds up to lobotomy.
This has been done before.
It hasn't
In fact,
been
it was
done
first
here.
done over 20 years ago.
Yeah, 20 years, and most hospitals don't do it.
Most patients have improved. Some have dropped more than 20 points on the Y-box. Benjamin Decatur could rejoin society. In success, he gets his life back.
Dr. Wilson, have you consulted with Dr. Ridgway on this matter? How delightful to see you can play well with others. Or is it only certain others? Do you concur that gamma knife is indicated here, Dr. Wilson?
Yeah, I do. This kid is out of options. This is perhaps his only shot.
And how good exactly is his only shot? Buck, comment?
One patient in Sweden underwent a similar procedure, only then to become a rapist.
No doubt Buck is offering that constructively.
That was not a gamma ray procedure, and it involved much larger lesions. We would target a more localized area.
What about cysts? One of 6 patients operated on with new model gamma knife in Rhode Island developed cysts. Doctors from Brown Pioneer stopped doing altogether. Now recommend thermocapsulotomy.
In those cases, 2 lesions were created on either side of the lower anterior capsule. I'm proposing that we only create 1 on each side.
Not work.
It can work. Look, we see suffering, we try to stop it. That's what we do.
Yes, that is what we do. And often with spectacular results. And we like spectacular, don't we, Dr. Ridgway? Makes us feel oh so spectacular. Dr. Ridgway, how's your marriage?
I beg your pardon?
I asked, how's your marriage?
I don't think my personal life is relevant to this discussion.
Oh, I think you're quite wrong there. We're not just doctors, after all. We're people, human beings. Our personal affairs are inextricably bound up with our professional behavior. And we're not just any people. We're supernovas, hardwired to succeed. And when we fail, we often try to compensate. We're so desperate for affirmation, in fact, that we can be quite pathetic. I mean, just think. The chance to perform a gamma knife psychosurgery. Oh, sexy. How are things at home, Dr. Ridgway? Nobody says goodbye anymore.
Difficulty breathing, horse kick to the chest.
Bay 3. How you doing, sweetheart? Okay, you and the horse?
Where she was riding. Well, had been riding.
Shortness of the breath.
1, 2, 3.
I forgot the rule. Stay
It's
and
okay,
kick
it's
away.
okay. Just turn your head to the right, yes, and turn your head to the other side.
Tachycardic, BP's low, pulsus paradoxus, O2 stat 94.
Any medical history I need to know about?
I don't know, I can't reach her mom.
And who are you?
Her trainer.
Okay, get an echo, tell them to come down here and do it.
We need consent to treat. Can you sign? No, I don't know if you can treat. They're Christian Scientists.
Okay, the first thing you need to do is calm down. Do not tell me that. There's nothing more inflammatory you can say to an agitated person than calm down.
Chill then, how's that?
To bring up my marriage in 311, my marriage.
And Villanueva calling it a lobotomy, for God's sake.
Well, it's surgery to effect a psychological cure.
It's gamma rays, Sid. We do it every day.
To destroy tumors, not part of the brain.
This boy cannot function. He will probably die if we do nothing, either by his own hand or starvation. Do we really think I'm trying to save him because my marriage sucks?
You had to expect pushback here. This hospital doesn't favor psychosurgery, and you... Okay.
Try and take a deep breath for me, can you? Hurts?
I'm not.
We're going to do something to get that pain under control.
I'm not in pain.
But you just said it hurts a lot.
I just need to concentrate.
On what?
She's going into respiratory distress.
Can you breathe easier like this?
I'll set up an amber bag.
Tracheal deviation. Call Dr. Napor.
Right away.
First off, I am very, very grateful. Beyond, you have to know that. If I have a child, I might name him Sung. That's how grateful I am.
What's wrong?
Well, since the procedure, I've had a certain behavioral side effect, which frankly I have a great deal of difficulty even talking about.
Oh, what mean?
She's having desires. All the time. Inappropriate urges.
Sex?
I've never had much of an appetite for... And I don't want one. This is very embarrassing.
Can you fix this?
Can I fix her want a sex?
Yeah. Dr. Park, again, we are so grateful to you for... I mean, her tremors are gone. So much good has come from this. But the ability to control your base impulses is what separates man from beasts. And I cannot have a wife who is in constant need.
Sex good. Good her, good you, help prostate.
I don't believe you're hearing us.
Sex good. Help a prostate, make pee better, reduce stress. Go.
Horse hoof to the chest. The blood is building up in the pericardial sac, collapsing her heart.
Tamponade.
Yeah, she needs to be tapped, but we can't find either parent. She's a minor Christian Scientist, no consent.
Court order?
No time.
How old?
15.
And how Christian is her science?
She's concentrating on healing now.
Her hands are tied. Gato.
Her heart is being crushed by her own blood.
Dr. Villanueva? Hi, Fran Horowitz, Risk Management. Good news. We've made contact with her parents. They're on their way.
My personal life? In that room, my personal life?
When you first interviewed here, I expressly warned you. Should you take the job, I own you. And from what I've observed of your behavior...
Do you really think I proposed surgery?
Consciously, of course not. But to fully rein in our unconscious, that's a much trickier proposition.
What this really comes down to is you doubt me as a neurosurgeon. If Ty Wilson stood up and said gamma knife was indicated, you wouldn't doubt him for a second, but me?
Two things about that. First, I happen to think you're a brilliant neurosurgeon. Second, you're no Ty Wilson. Now, at the risk of further incurring your wrath, let me say a third thing. Whatever's going on between you and Dr. Wilson, look at me, Dr. Ridgway. I'm offering this in the form of friendly advice. Now, your focus may or may not be compromised by your feelings for Ty. His focus, on the other hand, you'll never nick it. So don't be fooled. I want to meet him. The OCD boy who needs the procedure. I want to meet him. So, how are you, my friend? Question, do you tweet? I should think people would rather fancy following you on Twitter. No, I quite enjoy the delicious little Sung Parkisms that make their way around the building. Today's are especially delectable. Sex good. Make pee better. And gems like those travel fast. They have, in fact, made their way to the attention of Mitch Tompkins. You are being sued, old chap.
There's a sac around the heart, the pericardium. The kick must have caused some sort of internal bruise. The blood needs to be drained so the heart will be able to pump.
That's not possible.
What's not possible?
We appreciate your concern and kindness, but
I'm not trying to be kind.
we're trying to save your daughter's life in a way that contradicts our beliefs.
Miss Rivers, sir, with all due respect, you cannot pray this away. Would you like to see the bruise?
Doctor, I realize that you don't recognize prayer as...
I pray all the time, but as a treatment,
We respect your position, Doctor. We'd just like you to respect ours,
I
especially.
don't. Not if it jeopardizes an innocent life. I don't.
Gato, look, your God brought Abra to us, where a needle can cure the problem.
That's all it is. One needle.
No.
Look, I believe in God.
Please, remove that tubing.
Pulse ox is dropping.
She is going to die.
Remove the tubing so we can
You
take
could
her
face
home.
manslaughter.
And you could face battery charges. We know our legal rights, Doctor, as I'm sure you know yours. Now, please, remove the tubing.
Okay, but can I at least bandage the abrasions? It'll act as a splint on the chest while you drive home.
Gato, what are you doing?
Leave.
Gato.
You can stay or you can leave, Doctor. Good news.
Abra. Mommy.
She's gonna be fine.
What happened?
She just got better. A miracle.
She really okay?
Yeah. She'll be just fine.
I actually think this one will go away. The likelihood that a deep brain stimulation would render her oversexed. Have you ever known this to happen?
No.
And to your knowledge, were there any complications with respect to the procedure?
No.
You performed this operation before?
Once.
And the outcome there?
Dead.
Patient died.
Died. Dead.
Okay, he's marked up a deposition for tomorrow and asked me to waive notice. Not something that I typically agree to, but in the interest of making this go away, my gut says let's just do it. I take it you've been deposed before?
3 times. 2 settle, 1 dismiss. Always right.
Who's always right?
Me.
Always.
Always. 1 time thought wrong. Wrong. Right.
Hey, Lisa Decatur, Harding Hooten, Chief of Staff.
Hello.
Pleased to meet you. And where's,
This is Ben.
Hello, young man.
Honey, can you say hello to Dr. Hooten?
Not yet. It's not right.
If he doesn't take 2 steps sideways after every 3rd step forward, he's afraid his grandmother might die.
And he's not at school now.
He had to drop out in 11th grade. It was just too much. I quit my job for one where I could work nights so my husband or I can be with him at all times. Please.
Ben? May I speak to you for a few moments? Do you understand what we're talking about here today? Ben?
Help me.
We'll schedule him for Thursday.
I was planning to get Ty to assist. I think he's booked solid Thursday.
No, Ty won't be assisting you on this. I will. Now, it's important that you and Ben both know this procedure does kill brain cells.
That's been explained, Doctor. Both Ben and I consent.
Mrs. Decatur, given the suffering already endured by both of you, I need to be satisfied that your thinking has not been compromised by any undue duress. There are no guarantees. This is rarely done.
But it has been done. Successfully, right?
Yes. All told, about 100 times. Once on a boy very much like your Ben, a young lad who developed such a fear of offending God he couldn't go to the bathroom by himself. Now, this procedure is rare, but it has worked. And it can hear, but again, we're a little loath to do an operation that will destroy part of a person's brain.
You've seen my son, Doctor. Is there any chance his symptoms could just disappear over time?
On their own, no.
What are we waiting for then?
We wait because, again, we'd be altering his brain.
Tell me again. Exactly how you would do it.
We'd put him under a local anesthetic. We attach a stereotactic frame to localize the radiation and keep him perfectly still. He goes into a big machine. Gamma rays are emitted from hundreds of cobalt beams, which all converge on a specific focal point in the brain, forming a lesion.
And the risks?
Cysts, a low risk of stroke, apathy, none of which we expect to happen. In fact, once the symptoms lessen, he'll likely be able to reach his full potential.
If he were your son,
I would probably want to do whatever I could to mitigate his suffering.
Can we talk about this?
No.
Gato, you cannot expect me to turn a blind eye to what I saw.
That's exactly what I expect. Otherwise, the hospital gets sued, I get my ticket punched, and things get very messy. So let's go out, have a drink, and let today's narrative be little girl lives.
It's not that simple.
Yes, it is.
Your father's working. Some tea?
Thank you.
What's this?
Need studying. Gets sued.
Sued? For what?
DBS. Woman now wants sex, but in me. Need study. Deposition.
Hey.
What are you doing?
Looking at this gamma knife thing.
So you're doing it. They approved it. 311 went okay?
Yeah, it was approved. But I wouldn't say that 311 went okay.
So what happened?
Harding Hooten asked, how's my marriage?
Why would he ask you about your marriage at a 311 meeting?
Because nothing's off limits in there. And because I suspect he's heard rumors.
You're having an affair. With who?
I'm so sorry.
Well, As long as you're sorry. Do you love him?
I might. Mark's not gonna go anywhere, nor do I want it to. It was just...
Just what? Tina? Just one of those things?
So now what?
Now it's... My marriage has been pretty much over for a long time, Sid. And I know you know that, as kind as you've been not to point it out.
What can I do? How can I help? You'll stay with me for a while. You can't go back to that house.
He's moving out. He packed up last night.
Even so. You can't go back there, not for... You have a dog, a cat, any real reason you gotta be there?
No. We couldn't even commit to a dog.
Well, first, let me say how utterly delighted I am to be here. I typically find my visits to Chelsea General to be enormously fruitful. Before we go on the record, let me say, if at any time you do not understand my question, Dr. Park, please feel absolutely free to say so, and I will restate it. Though, in theory, this is supposed to be an adversarial process, I would never endeavor to forsake good manners. Which is why I like to think, more times than not, my depositions tend to be a benign experience. Though, admittedly, not always. Shall we begin?
Is she okay? She will be. But, we need to be there for her a little bit more. Pick up some slack if she needs us to.
Dr. Napur, tell me about the young equestrian you were treating, the one of the Christian Science faith.
She was stable at discharge. She'll be fine.
Excellent. And how exactly did she become fine, if I might ask? Good medical treatment?
We didn't really have to do anything, actually.
She just spontaneously healed. Don't you love it when that happens? Did you hear, Dr. Robideau? Her heart sac was filling with blood, and then suddenly it drained itself.
Gotta love that God guy. Sorry. Uh-oh, we've got trouble.
Ty,
Mark?
you seen Tina?
In her office, I think. Look, Mark.
Marriage was over anyway, right? Isn't that what people in your position like to say to yourselves? Marriage was over anyway. No harm, no foul.
Mark?
Consider yourself served.
Dr. Wilson, if I might speak to Dr. Ridgway for a moment. First, are you all right?
Yeah, I will be.
Could you look at me?
I'll be fine, Harding. I wouldn't touch a patient if I wasn't convinced of that.
Tina, I wouldn't let you treat Benjamin Decatur if he were the last patient on Earth. But he's not. There'll be another patient after Benjamin, and another one after that, and another one after that. There are many lives in play here. I need you back in the saddle, so you'll scrub up and you'll buck up, as the expression goes.
Thank you. I won't let you down. I won't let Ben down.
No, it's not for you.
What's up?
So, everybody knows.
Well, pretty much.
How'd you even know to find me here?
You come here a lot. My guess is you sit here, take all of this in, and ask yourself, am I a doctor, a wife, or a mother? All the bullshit that biology does to the female's brain once she hits a certain age. You're a doctor. A very good one. Maybe a decent mother one day, but you weren't meant to be with Mark, that's all.
How can you know that?
Because he's not a doctor. You need to be with a surgeon. At the end of the day, we all need someone we can talk to. And I suspect you didn't have that with Mark. I'm not crystal balling you. Nah, I've been there. I'm divorced, remember? Look, I'm not here to hold your hand. I need another surgeon to work the ER late night. You're it.
Excuse me?
Yeah, you heard me. Besides, it sucks going home to an empty house anyway. Believe me, I know.
And when exactly do you expect me to sleep?
I think you'll figure that out.
Find right coordinate, pick brain, tremor stop.
Tremor stop. The operation was a success then, was it?
Yes, complete success.
Complete success. So the idea that my client was left with an overactive libido, that would be of little, if any, consequence.
Not foreseeable what happened.
Not foreseeable what happened.
No.
Doctor, did you ever come across the tale of Phineas Gage in all your studies?
Of course.
What is that tale, if you wouldn't mind regaling us?
1848, construction foreman for railroad. Piece of iron shot in his brain. Accident, go through frontal lobe.
Did he survive?
Yes.
No complications?
Became grumpy, affect personality, reasoning skills diminished.
His brain was changed?
Yes.
And why did that happen, doctor?
Not know. Brain very mysterious. Physiologists did not understood completely.
Even in 2013, the human brain remains largely unknown to us.
Yes.
So it might be foreseeable, then, that sticking a probe into a brain might affect that brain in mysterious ways. By the way, did you mention all this to my client, doctor? Did you tell her that the physiology of the brain is so mysterious that anything could happen once you start sticking probes into heads? Did you point out that unforeseeable events might occur? As it turned out, the pleasure center of my client's brain was affected by this deep brain stimulation, was it not?
Seems so.
You inserted a probe into Beth Hostetler's brain, stimulated her brain tissue, and in so doing, awakened an insatiable carnal desire. Would that be a fair description of what transpired?
Fair description would be she had disabling tremor, ruin her life. I make stop.
I see. Going into this procedure, doctor, did you have any sense that Beth Hostetler was a religious woman? Someone whose very being could be undermined by this newfound promiscuity?
You should be ashamed.
I'll ask you not to address my client,
She's
sir.
my patient, I address. You come, beg me to help. You have tremor you won't stop. That's what you tell me. I give you life back, and now you come with Royal look for money.
Doctor?
Shame. Maybe procedure affect honor. Maybe DBS change integrity.
Maybe if you hadn't have been so dismissive, so rude.
Not sue me rude, not sue me dismissive, sue me medical malpractice. Where is your honor? 2 weeks ago, you could not hold pen, could not write. First thing you do after procedure, you sign name on complaint, sue me for malpractice. No honor you. No honor you. No honor you. Especially you. Shame. Everybody.
Okay. Benjamin, and today's the day. Are you ready, my friend?
Yes.
Well, first we're going to attach this frame to your head. It's called a stereotactic frame. It's a stabilizer. It'll keep your head in place.
Will it hurt?
You won't feel it. We'll give you a shot, like Novocaine at the dentist.
It's been cleaned, right? Everything's been cleaned?
I promise.
Now, once it's attached, they'll take you to another room, and I'll meet you there.
Well, where are you going now?
Well, I've been summoned to a big kahuna meeting. Well, actually, I did the summoning. I'm the big kahuna. Dr. Ridgway will be here with you.
The frame, you can do it, right?
Absolutely, Ben. Of course.
Do we know who this is for?
I have a pretty good idea.
Tell me.
No, I don't want to ruin the surprise for you, Buck.
All right. Thank you all. This will be a short one, as I have a procedure scheduled. So let's get right to the guest of honor, the big cat himself. Would you join us, please, Dr. Villanueva?
Okay.
Arbra Rivers.
Arbra Rivers, 15-year-old female, kicked in the chest by a horse. I performed a pericardiocentesis, removed 30 cc's of blood, patient stabilized, and I expect a full recovery.
Splendid. Is that the whole story, or is there more, Doctor?
Both the patient and her parents refused treatment on religious grounds.
And you chose to unilaterally override their religious concerns?
Indeed.
Ah. Doctor, do you have a particular repugnance to Christian Science, or would you have discriminated against any other religion?
I'm an equal opportunity bigot, if that's where you're headed. If a patient comes into my ER dying, and I have a means to prevent it, I'm going to do it, period.
Because in your ER, you're the Almighty.
You get that right.
I so love it when I get it right. But you also enjoy getting it right, don't you, Doctor? But the problem I have here, Gatto, is that it's not your ER. It's Chelsea General's. And when you violate hospital policy, not to mention the law, you jeopardize the integrity of this institution and all the... Don't turn away from me. You may not dignify Christian Science, but you will damn well respect me. I've earned it. Plus, it comes with my title.
Harding, it's do no harm. A 15-year-old girl is alive. I'm sorry if your integrity got dinged.
Such a deliciously defiant big cat, aren't we? Comments? Anyone? I have a comment. Now, I may have done the same thing as you, Doctor. After all, when a person walks into a hospital, there is an implied consent to treatment at some level. And the idea of letting a little girl die, no. No, the more I think of it, the more convinced I am I would have done exactly the same as you. Except for one difference. I might have given the matter some pause. I might have taken a beat to acknowledge the patient's autonomy, her personal sovereignty. Yet we doctors, we see the organs, the diseases, all the parts. And in doing so, sometimes we skip over the whole. Perhaps I too might have overridden the religious rights of this family, just like you did. But I would have at least recognized them first.
Dr. Park? I am ashamed. You gave me back my life. I'm dismissing the lawsuit, and I'm so sorry. I don't know what came over me, or why. Perhaps the procedure caused an error in my judgment. Maybe I'll sue you for that later. I'm kidding. Anyway, before I signed a complaint, I drew a picture. I was a little bit of an artist before I got the tremors, and when I got my hands back, I decided... Anyway, forget about the lawsuit. It was a big mistake. I want to leave you today with a profound apology, my sincerest gratitude, and this picture. I hope you don't mind I gave you a little bit of a smile.
The anterior internal capsule is very well defined here.
We can put 4mm isocenters here and there, one shot each side of the lower capsule. Standard dose?
Yeah, I think 140 Gray should do very well for the next several months.
Careful around the blood vessels. They could have contributed to the cysts in the other patients.
Right, I'll meet you at radiation therapy. I'm going to recheck the frame before we start.
Okay.
What's happening?
Oh, we just finished programming the radiation doses. We're about to begin.
Wow, talk about high tech.
Yeah.
Listen.
Not now. Okay. We can talk later, but right now...
Got it. Good luck.
Thank you.
Well, well, well. You look better, I see.
It's the man who speaks softly and carries a big needle.
I don't know what you're talking about.
I know what you did. I may have been half unconscious, but...
Well, if you came here to chew me out, you're late. It's already been done.
You saved my life.
That was the idea.
But you also took something from me.
What?
My faith. I'm breathing. And my heart, it's beating. But knowing that God might have just let me die.
Well, what the hell are you talking about? I mean Catholic hell, not Christian Science hell. Sweetheart, you lived. And from where I sit, God and I tag-teamed you on this one.
I think I should lose my faith.
No. If it works for you, keep it. I'd lose the horse, though. Take care of yourself.
You too.
He said.
Okay.
Here we go.
Fingers crossed.
Indeed.
Hello? Dad, hey, hi. So funny, I was thinking of you today, too. Just missing you, I guess. How are you? How's Mom? Me? I'm great. Yeah, I had this totally radical procedure today. Radiological psychosurgery. Radiation. It's called Gamma Knife. I'll send you a YouTube link. You can see what it is. Yeah, it's gonna have to sink in, Dad. Your little girl's a brain surgeon now. Mark's good. You know what? I just walked in the door. Can I call you back in like 10? Yeah? Okay. I love you.
Why I was the one
No, you don't. I've got bald dibs on this place.
Whatever he's having.
So, how did the lobotomy work out?
Very well. So well, in fact, we're thinking of trying one on you.
Oh, you doing stand-up now, huh? Just because you look funny, don't make you funny.
Someone comes into my ER, dying. I fix it.
You damn well better respect me. It comes with a title.
That's not bad.
So, it really did go okay. The boy's gonna be all right.
I think he has every chance, yes.
Here's to that.
Indeed.
Such a defiant big cat.
Yes, all right, all right.
So tired.
You stink!